And we're going to the Health Hub Times Square in Ballincollig, where Anneliese Dressel joins me. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
Did you shake off the cough?
Well, still a bit have it. I'm not expecting it to kind of go fully, judging by everybody else. It seems to linger for 4 or 5 weeks at least.
Yeah, because we had Dr. John Sheehan, the GP in Blackpool, on the programme last week, and he was talking about it, and he said, yeah, good month to 6 weeks people are being left with it. It's just, it's a nasty one for sure. Okay, straight into a question, somebody getting over COVID. Hi, my mum, who's in her early 90s, just getting over COVID. Janet says, I want to give her a tonic. What tonic would you recommend for a 92-year-old?
So the Source of Life Gold is always a tonic I recommend. However, there is a little bit of ginseng in it, and that would not be suitable for somebody who would be on a blood pressure medication. So if your mum is on a blood pressure medication, that's not good. That won't work. So in that case, I'm recommending one called, it's called Vibracell, Vibracell, and it's by a company I think called New Era. And we got very good feedback on that recently when the Source of Life Gold wasn't available for a long time. So we had a lot of customers trying it, and that is suitable with all medications. So if the other Source of Life would be my first choice, secondly, Vibracell.
Okay, and a child getting over a COVID is very tired. It's a 5-year-old. What would you recommend?
So there's two things that could work here. Now the company that make the Source of Life Gold, they actually do vitamins for kids as well. They have got it in a liquid form. It's also called the Go. It's Animal Parade is the name of it. The company is Nature's Plus, and it's their Gold tonic. So that would be a very good tonic for a kid. But also, we've been getting fantastic feedback on a kind of a mushroom extract complex for immune system. We started stocking it again recently. It was reformulated, and the feedback on it is amazing. So it's by a company called Hifaz de Terra, Hifes de Terra, Derra. They're a Spanish company, and they specialise in mushroom extracts, which are amazing for the immune system. So you want the immune blend for kids, and that's a fantastic immune booster.
And is there an adult one as well, obviously?
There is adult mushrooms. They come more in a capsule. This kids one is fantastic. It's in a juice and it doesn't taste of mushrooms, so It's very easy for them to take.
Yeah, it's hard to get kids to swallow anything. Okay, Carmel says, I wonder, could you ask, what would Anneliese recommend something to decrease a high ESR blood rate result in an elderly woman? Now, ESR measures the rate at which the red blood cells separate from the plasma and fall to the bottom of a test tube.
Yeah, you know what now? I don't know the answer to that one, Patricia. Excuse me, I wonder, is there something to do with inflammation? I'll have to look that one up.
Yeah, it does seem to be to do with inflammation, and it's red blood cells, and it's to do with inflammation in the blood.
Yeah, I honestly...
Inflammation in your body, yeah.
Yeah,
okay.
I mean, generally the natural anti-inflammatories that are wonderful for anything anti-inflammatory are things like turmeric and boswellia would be my two favourite. I was reading an article this morning about one called astaxanthin, which is also wonderful for preventing macular degeneration, but it seems to be incredibly beneficial as an anti-ager and an anti-inflammatory in the body. But really, I wouldn't be confident saying that was the right thing for high ESR levels, so I'll have to come back to you on that one.
All right, please do. Any advice, please, for somebody getting ocular migraines?
So migraines are always a very difficult one, Patricia, because it's really about, for people, identifying triggers. And there's lots of people actually developed different types of migraines after COVID as well. So it's very, very difficult to understand what triggers migraines. I mean, it's definitely a sort of something that affects the brain chemistry, and then you get these type of migraines. So it could be a structural issue where there's a nerve trapped. It could be a viral issue. Post-COVID, a lot of people were getting vestibular migraines, which was more about kind of really being dizzy and feeling black spots in front of the eyes. That was very common post-COVID. For other people, typical triggers would be things like chocolate is a very big one, caffeine is another one, stress is another one, posture is another one. And for some people, they find that prevention is really the way to go, and taking magnesium would be very good. I think I would recommend magnesium taurate as the best type of magnesium for migraines. And then also a very high dose of a vitamin B2, which is riboflavin, and you're going to need 400 milligrams of that every day as a preventative.
Yeah, I was listening to Joe Duffy a few weeks ago on Liveland, did a programme on migraines, and my God almighty, some of the people talking about how debilitating, like very severe migraines can be. I mean, it was just shocking. And one of the ones, and actually somebody earlier on sent in a message about it for people with epilepsy. Do you know all the twinkling lights for Christmas? That for people who are sensitive to those lights, they can bring on migraines.
Absolutely, I would believe it. And actually, just speaking of epilepsy, and I suppose really maybe this could be something that could help with migraines that were triggered by things like that. Cannabis oil is wonderful, Patricia, as we probably remember from, there was the big fight that a mother down in Kerry had to fight very hard to get it for her daughter. So the cannabis oil can massively cut down on the duration and the frequency of seizures. So it's possible it could be something that could work very well for migraines. Again, there's such a personalised thing that you'd have to try it to see. And it would be about not treating them with cannabis oil. It would be about taking the cannabis oil every single day as a preventative. And I've seen wonderful results with that CBD oil. Now, this is the one without the bit that gets you stoned, the THC. Yeah. And I've seen fantastic, I have had fantastic feedback on it, not just for epilepsy, but for some people with Parkinson's as well. It very much helps with the tremor. It's some people that get a wonderful result for pain from it as well. So that would be definitely worth a try for ocular migraine as well.
Okay, all right. Rose in Cork has a pain in her shoulder. Now, the doctor says it could be frozen shoulder. She's wondering, could you recommend anything for the pain? Rose has a fear of enclosed spaces, so she can't go for a scan to confirm if it is a frozen shoulder.
Yeah, well, you know what? So even if they confirm it, there's not a whole pile they're going to do for it anyway, Patricia. Frozen shoulder, actually, I think is what happens there is you get massive inflammation in the tendons around the socket of the arm. So the big thing would be that you'd find it very hard to raise it. And my own experience with frozen shoulder, and I've seen lots of people with it, is that it's really time and rest. Now, you could try a couple of natural remedies to see would they help, but sometimes actually going to see a chiropractor that can kind of manipulate it so that there maybe isn't stress and pressure on the nerves and on the tendons, and maybe even getting a cortisone injection from your doctor might give you some relief as well. But there is no perfect method. So the natural things you could try, Rotagrav is a homeopathic remedy. It's, you know what now, in terms of its efficacy, I'd say like 1 in 4 people will get a great benefit from it, and the other 3 in 4 probably won't. But it can work very well. It's spelled Rutagrav, Rotagrav, and that's for tendinitis. So you could try that, and then things like high-strength turmeric extract and boswellia. So we have a supplement here called Curcudine Forte, Curcudyn Forte, and it's a combination of both of those, and that's a very good natural anti-inflammatory. And then personally what I would find helpful is rubbing something in that kind of heats up and gives a bit of immediate relief, which is the Pernaton gel. It's wonderful. You need to get the hot one, the red one, and there's a cooling one and a hot one. So get the Pernaton, Pernaton gel in the red colour, and rub that on morning and evening, and maybe a bit of acupuncture. You'll have to throw everything at it, and hopefully something will stick.
It can be very painful. Mary's in Clon. She's on 4 different tablets. She's on Caltrate, red yeast rice, glucosamine and silica. When is the best time of the day to take them, and can she take them all together?
She possibly could, really. I find that taking a lot of tablets at the same time might make people feel a bit nauseous. So in that case, I would definitely, if you want to take them all together, I'd recommend them taking them after either lunch or dinner. Make sure you have something in your stomach first. The calcium as well, you probably should take that. Definitely don't take them at night, because really your digestive system won't be as possibly as efficient in terms of absorbing. So I would either take them separately, the calcium one in the morning, or if you're going to take them all together, take them after a bigger lunch.
Okay, what would you, Anneliese, is there anything you could recommend for a flare-up of gallbladder? Trish is from Trish in Cork. She had bacon and cabbage the other day, and it has caused a flare-up, and she's been in agony since.
God love her, yeah. And there's actually, it's like kidney stones as well. The pain can be excruciating, and the nausea actually as well, because anything you eat then seems to irritate you. So I would recommend a product by a company called BioNutri. Now, it might be difficult to get because it's a practitioner product, but they do one called Taracyn, Taracyn, and it's a combination of things to support, to bring inflammation down in the gallbladder and to support the production of bile, which will help flush the gallbladder. And I also would recommend something to help you digest fat in the meantime, because if your gallbladder now is inflamed, you're not going to be producing all of the things that you need to break fat down, and that's what's going to give you the indigestion and make you feel so nauseous. So my favourite one for that is a company called BioCare. Not that the first one is BioNutri. It's BioCare, and it's called Artichoke and Lipase Complex. So that's artichoke, like the vegetable, and lipase, Lipase complex.
Okay, and very finally, what would you recommend for somebody who suffers from cysts on the eyelid and styes? It's my husband gets them regularly, says a listener.
I really don't know about that one, Patricia. So it's like some people, the Dr. Delish Clare Healing Cream can work really well for some people, and then for other people it doesn't work at all. I've had not quite styes, they're not really styes that are they're like a little skin tag. And I've been using a cream called Liposalve that seems to have reduced the size of the little tag on my eye. So if it's more of a tag, that Liposalve could work. Actually, just now I had a think about that, and castor oil could be very good because I've been doing a good bit of research about it, and castor oil used to be traditionally used to draw pus out. It used to be used as like with mustard as a pack to take pus out of abscesses. So if this is like a sty, if it's filled with pus, something that will draw that pus out. So you could try castor oil. I'd actually probably put it onto a cloth of some sort, like a very thin muslin cloth, and I'd place it on the eye, and then I'd put a warm hot water bottle on top of it and see can it just draw it out.
Okay, listen, we leave it there as always. Thank you for that. It's our last one for the year. Thanks for all your contribution.
Christmas.
Happy Christmas to you, and we look forward to chatting in 2024. Have a good one. Thanks a million. That's Anneliese Dressel, the Health Hub, Times Square in Ballincollig. She'll put up all of the information that she just gave on her website this afternoon, healthhubstore.com.